Hi everyone, peace to you all. I am Masood Saeed, a social science psychologist. Have you ever wondered what the early signs of autism in newborns might be? It's a question that plagues many, especially if they have any family history of autism spectrum disorder. Autism, a multifaceted developmental disorder, exhibits consistent challenges in social communication, verbal and nonverbal communication, and narrow or recurring behaviors, which can be identified as early as infancy. According to a study published in the International Journal of Epidemiology, these early signs include lack of eye contact, not responding to their name or to the familiar voice of a parent, and not pointing or waving goodbye. The American Academy of Pediatrics also notes that a baby who doesn't show these signs of typical development might have autism. Recognizing these indicators as early as possible is essential because, as research from the Journal of Autism and Developmental Disorders suggests, early intervention can substantially improve the child's developmental trajectory. Step 1. Observe their gaze. Infants as young as 2 months old typically enjoy looking at faces. A study conducted by the Harvard Medical School explains this behavior as a form of early social interaction. If you notice your infant is not maintaining eye contact or seems uninterested in faces, it could be a sign of autism. Dr. Catherine Lord, a leading specialist in the field of autism, states that this might be one of the early signs of autism disorder. However, it's paramount to keep in mind that not all infants with autism will avoid eye contact, and not all infants who avoid eye contact have autism. This is corroborated by research from the American Academy of Pediatrics, which affirms the complexity and variability of autism symptoms. Step 2. Take note of their social smiles. Professional studies show that babies typically begin to socially smile around 2 months old. Esteemed child psychologists and pediatricians regard this as a crucial stage in a baby's emotional development. If your baby doesn't display social smiles or cheerful expressions by 6 months of age, experts opine that it could be a matter of concern. It is strongly recommended to seek advice from your pediatrician in such a scenario. Step 3. Pay close attention to their babbling patterns. By the time they reach 6 months, babies typically begin to babble, a crucial developmental milestone noted by child psychologists such as Dr. Patricia K. Kuhl, a pioneer in the field of language acquisition. By 12 months, babies often start making gestures like pointing or waving, another critical stage in their communication progress. Renowned pediatrician Dr. T. Barry Brazelton emphasizes the importance of these gestures as a part of a child's overall development. If these milestones are delayed, according to numerous studies such as that of Dr. Catherine Lord in the Journal of Autism and Developmental Disorders, it could indicate a potential warning sign of autism. Step 4. Pay close attention to their reaction to their name. According to a study by the Journal of Pediatrics, by their first birthday, the majority of infants exhibit some form of response when their names are called, even if it's merely a glance in the direction of the sound. Renowned child psychologist Dr. Richard Schwartz also underlines the importance of this name recognition, noting that it's a key milestone in a baby's cognitive development. However, if your baby does not respond when their name is called, it might indicate a potential issue. Various studies, including findings published in the Archives of Pediatrics and adolescent medicine suggests that this could be an early sign of autism. Step 5. Observe keenly for any repetitive behaviors. According to research from the American Journal of Psychiatry, infants exhibiting autism might display behaviors such as rocking back and forth, flapping their hands, or spinning in circles. Renowned child psychologists like Dr. Catherine Lord emphasize that such repetitive behaviors can be early indicators of autism. The significance of observing these behaviors in early infancy cannot be overstated, as they can provide critical insights into the child's cognitive development. Drawing upon professional studies and expert opinions, early indications of autism in newborns may include tendencies to avoid eye contact, an absence of social smiles, delayed babbling, unresponsiveness when their name is called, and the exhibition of repetitive behaviors. It's important to highlight that these signs are not definitive proof of autism, but rather potential markers. Experts assert that these signs alone cannot establish a diagnosis. A comprehensive evaluation by a medical professional is indispensable for a definitive diagnosis. Dr. James McPartland, a renowned child psychologist, once said, "Early intervention is key." So, if you notice any of these signs, it's crucial to consult your pediatrician. Numerous studies, such as those published in the Journal of the American Academy of Child and Adolescent Psychiatry, have emphasized that it's never too early to seek help. In fact, the earlier autism is diagnosed, as per the research of the American Journal of Psychiatry, the sooner the child can receive the help they need. This underscores the paramount importance of prompt action and intervention in managing autism. Thank you for joining today's conversation about identifying signs of autism in newborns. This is a critical issue that cannot be underestimated. Dr. Jane Stewart, a leading authority in pediatric neurology, affirms that knowledge is the first step towards understanding and acceptance. Recent studies from the Autism Research Institute further underline the gravity of this matter, asserting that early detection can significantly improve the quality of life and developmental outcomes for autistic children. Therefore, it's crucial to stay informed, stay observant, and most importantly, stay supportive. Let's empower ourselves and our little ones with all the necessary information for a better future. Please do not forget to click on like, subscribe, and share. Not to see it, let's take a moment to visually recap what we've learned today. As we navigate through this slideshow, remember, every child is unique and may not exhibit all of these signs or may exhibit them differently. The first sign we discussed was about gaze. Babies with autism might avoid eye contact, which is a key part of early social development. Next, we talked about social smiles. Autistic children might not return smiles or show less interest in social interaction. We also touched on babbling patterns. Delayed babbling, or lack of it, can be a sign of autism in babies. Remember the importance of response to name. Children with autism might not respond when their name is called. Lastly, we discussed repetitive behaviors. This could include gestures like hand flapping or rocking back and forth. This visual recap should serve as a helpful reminder of the signs we've discussed today. Remember, if you notice any of these signs consistently or are concerned about your child's development, it's crucial to consult with a healthcare provider or a specialist. Knowledge is power, and early detection can make a world of difference. Do not forget to click on like, subscribe, and share.